So you want to know what's the truth about the PSA test? Well, in this video, you're going to learn all about the PSA test and what's true and what's not true. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher. And this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. By the way, if this is the first time on this channel and you like to get fact-based healthcare information, please hit the subscribe button. HEALTHdrum provides material for educational and informational purposes only and is not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start sorting fact from fiction. So I spent many years writing blogs and challenging the prostate cancer narrative. It just didn't add up. It's a fear-based narrative with exaggerated risks and mostly founded on beliefs, opinions, and assumptions. And most, if not all, prostate cancer studies are not based on sound scientific principles. Recently, I posted a YouTube video, What's the Truth About Prostate Cancer? Now, this video got a lot of attention, so I decided to examine in detail various parts of the prostate cancer narrative so you can be informed. Let's drill down some on the PSA test and the business of PSA testing and try to see what this is all about. So here's some marketing claims made about the prostate-specific antigen or PSA test for prostate cancer. That early prostate cancer detection may make it easier to treat the cancer. That early detection may decrease the risk of spread. That early detection may decrease the risk of death. And that it may help patients with testing and treatment decision-making. As well, there was a belief that the test could be reassuring if normal. You will see that many of these claims are not definitive and always use the word may. May do this, may do that, and so on. The sad reality is that all of these marketing claims are hollow. So not only are there many wild claims about the so-called benefits of PSA testing, but they even go so far as to recommend it for certain risk groups. So these are some of the many other claims about who should get the PSA test and prostate exam or digital rectal examination. Anyone with urinary symptoms, anyone with sexual dysfunction, if you have a trace of blood in the urine or semen. The tests were in fact claimed to be part of a man's health evaluation. As well, they focused on so-called risk groups such as African American men, those with a family history of prostate cancer, and those with certain inherited gene mutations like the BRCA gene. However, these claims are just claims. Not only is the prostate exam highly unreliable, but there's no scientific evidence that urinary and sexual symptoms are early warning signs of prostate cancer. As well, there's no scientific evidence that early treatment of prostate cancer extends life. Urinary and sexual symptoms are simply signs of aging. Urinary symptoms worsen as the prostate enlarges with age, and sexual function also diminishes with age. So what exactly is the PSA? So the PSA, or prostate-specific antigen, is an enzyme found in the blood. It's a type of serine protease, and its function is to liquefy the ejaculate so sperms can travel up the uterus. So is the specific label for prostate-specific antigen true or another deception? So the word specific in prostate-specific antigen is a barefaced lie. It's not specific to the prostate at all. It's found in benign prostates and cancerous prostates. It's found in both male and female ejaculates. It's found in breast milk and amniotic fluid. And the PSA is unable to determine whether the prostate cancer is low risk and outlived or aggressive. So the PSA is not specific to the prostate, but is it reliable? So the PSA test is highly unreliable. It has a false positive rate of about 78%. Its so-called normal range of 0 to 4 is pure fiction and made up. PSAs can fluctuate wildly throughout the day and vary from lab to lab. The PSA is easily raised by everything from sex to inflammation, to the prostate exam, bike riding, catheters, UTIs, and so on and so on. So the bottom line here is that the PSA test is based on falsehoods, false positives, false hope, and false promises. So the PSA test is not specific and highly unreliable, but can it predict significant prostate cancer? PSAs rise with age as the prostate enlarges, and this is perfectly normal. So the PSA is a very poor predictor of significant prostate cancer, and that's because some of the high-grade prostate cancers produce little or no PSA and will go undetected. Furthermore, a normal PSA doesn't mean no cancer, a low PSA doesn't mean no cancer, and a high PSA doesn't mean you have cancer. Many sluggish growing cancers are detected because the PSA was elevated by the enlarged prostate and not the indolent cancer detected. So the bottom line here is that most prostate cancers are typically small in volume, low grade, without symptoms, and outlived. So the PSA is not a good predictor of significant cancer. But does PSA testing save significant numbers of lives? So urologists' own studies have shown that at 7 years and 10 years, there is no evidence that PSA testing leads to life extension. In fact, there's no evidence for saving significant numbers of lives for either PSA testing, PSA-based screening, or for PSA monitoring. So the PSA test is highly unreliable and fails to save significant numbers of lives. But what about all the other markers that are claimed to be indispensable in the prostate cancer arena? The prostate cancer market is flooded with hopeful-sounding next-generation prostate cancer markers, such as PSA derivatives, PSA density, PSA velocity, pro-PSA PCA3, PHI or prostate health index, and numerous other blood, urine, and spit markers, genome tests, indexes, scores, and so on and so on. However, there is no marker that can reliably identify life-threatening prostate cancers and guide patients to scientifically proven better outcomes. So the PSA test is highly unreliable and fails to save significant numbers of lives. So how did it become FDA approved and so-called standard of care? So the initial hearings for the FDA approval of the PSA test were held in 1985, and basically this was to assess if the PSA was useful for tracking a response to treatment and monitoring for relapse. And it also appeared safe and effective. However, as detailed in the book by Ablin and Piana, The Great Prostate Hoax, there was a significant amount of industry manipulation involved in getting this so-called test FDA approved for the monitoring of prostate cancer. In other words, follow the money. Sadly, no one in these regulatory agencies thought to determine whether any studies delivered irrefutable and reproducible evidence that PSA monitoring led to life extension. So how did the test go from being FDA approved for monitoring become FDA approved for screening and cancer detection? So the PSA test, after being initially approved for monitoring after prostate cancer treatment, was subsequently FDA approved in 1994 for prostate screening and detection when it was combined with a prostate exam or digital rectal examination. The clinical studies forwarded for the approval suggested an ability for the PSA to lead to cancer detection. A cutoff level of 4 for the PSA seemed reasonable, but there was no scientific evidence that the PSA test led to life extension. Again, the urology community routinely fudges the word cancer as if all prostate cancers are equal and deadly. However, prostate cancers are not all equal and deadly. The Gleason 6 is a bogus cancer. Most other prostate cancers grow sluggishly and when detected are usually small in volume, low grade, without symptoms, and outlived. And it's mostly only the 10 to 15% of high-grade prostate cancers that are potentially deadly. So how come the PSA test suddenly became standard of care for prostate cancer detection when there was no evidence for life extension? So the fact that the PSA test was FDA approved for screening without any irrefutable and reproducible data for saving significant numbers of lives was absolutely remarkable. The PSA test was associated with endless false positives and false negatives. As well, the test led to overdetection and overtreatment of insignificant prostate cancers, and treatments led to endless complications. In fact, the misguided FDA approval for the PSA test simply underscores how healthcare regulatory agencies can fail to protect patients. Only the USPSTF determined that the harms of PSA testing outweighed any benefits. So what are the criteria necessary for a screening test to be useful? So there are established criteria for what makes a screening test useful. And it seems incredible that the American healthcare regulatory agencies failed to recognize this simple requirement. In fact, in order for the screening test like the PSA to be useful, the test needs to be sensitive and specific, very reliable, cost-effective, and be supported by irrefutable and reproducible scientific data for improved outcomes. However, by any standards, the PSA test is a colossal failure, and the FDA approval of this test is inexplicable, and the test cannot be considered standard of care. So clearly the PSA test doesn't meet the criteria for being a useful screening test. So why is it such a failure? The PSA test is a colossal failure because it's not sensitive for all high-grade prostate cancers, because some of them produce little or no PSA and will go undetected. It's not specific for the prostate or for prostate cancer. The PSA test is highly unreliable. The PSA test is relatively inexpensive, but PSA-based screening fails to save significant numbers of lives. So where's the accountability for failed FDA approvals? So clearly the PSA test is a screening failure, but why is it still heavily marketed in prostate cancer awareness programs? So after the FDA approval for the PSA test, the marketing ad agency for the PSA test maker took the whole deal a step further. They devised the September Prostate Cancer Awareness Program. They weaponized the cancer label through unbridled fear-mongering. As well, their program exaggerates the risks of prostate cancer and promotes the myths of benefits for prostate cancer screening using the PSA test and a prostate exam. The program was very successful and fooled physicians, regulatory agents, and sponsors to adopt this misguided screening program. And the program was totally indifferent to the collateral damage suffered by the wives and partners of these patients. No one in the prostate cancer arena asked the most basic of questions. Where is the irrefutable and reproducible data that PSA-based screening saves significant numbers of lives? In contrast, the Prostate Cancer Awareness Program is nothing but a danger to health. So PSA-based screening and prostate cancer awareness programs fail to save significant numbers of lives. So where do we go from here? Sadly, both PSA-based screening and prostate cancer awareness programs have no supporting irrefutable and reproducible data that they save significant numbers of lives. So what is the path forward? When urinary and sexual symptoms are not early warning signs of prostate cancer, the PSA test is highly unreliable, the prostate cancer narrative is false, most prostate cancers are outlived, and the prostate cancer narrative is based on recycling misinformation and exploiting fear and doubt. We need new tests and treatments through new science and honest science. No more billion-dollar illusions. And when a test or treatment is recommended, you should ask one simple question. Where's the irrefutable and reproducible scientific proof that this will help me live longer or better? Sadly, at this point, it doesn't exist in the prostate cancer arena, and the FDA approval for the PSA test needs urgent reevaluation, as the current recommendations for prostate cancer screening are a public health disaster. So let's recap. In this video, what's the truth about the PSA test? You learned that the PSA test is not specific for prostate cancer, it is highly unreliable, and PSA testing fails to save significant numbers of lives. To learn more about routine medical conditions, self-care, and digital health, check out some of these other videos. And if you like them, hit the share button and share them with your friends.